Welcome to Open on BronxNet. I'm your host, Sonyi Lopez, inviting you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. Adopting the use of face masks to slow the spread of COVID-19 has become the new norm. Should we expect masking to ever go away, or should we prepare to continue wearing masks post-pandemic? Joining us now to share more is Dr. Panagis Galiatsatos, Assistant Professor of the Division of Pulmonary and Critical Care Medicine. Welcome, Doctor. Thank you so much for joining us.
An honor to be here. Thank you so much for inviting me.
Of course. So let's get straight to the point. Should we expect to continue wearing face masks even after the pandemic diminishes?
I'm going to make the assumption that I think it will still likely be a personal decision if those face mask public health requests have been removed. However, I do want the population to strongly consider it. For example, this year alone, we saw drops significantly in other airborne diseases such as influenza, RSV, and a lot of it has having to do with both physical distancing as well as face mask policies. So I'm hoping people, if they are going out into public and may have a runny nose, grab a face mask, right? It's one great way to be effective to not spread germs where you go out. And I say this as a lung doctor too, right? A lot of my patients wear face masks because sometimes they harbor bad germs inside their lungs and they don't want to spread that to other people. So I'm hoping face masks do become a public health acceptance, regardless if it is mandated or not.
Thank you, Doctor. Are there currently any downsides to continued mask usage over time that we should know about?
None that I'm aware of. And I see this as a person who wears face masks probably about 12 hours a day in the hospital. In addition to, keep in mind, as lung doctors, we see a lot of patients with really decreased lung function. One of my favorite cohort of patients who always are near and dear to my heart are those struggling with cystic fibrosis. Many of these young adults that I take care of are operating with about 30 to 40% lung capacity, and they wear face masks all the time when they go out into public. As I said, some of them may harbor some bad germs in their lungs, and so they don't want to spread that when they go out. So they wear these face masks and are perfectly fine. Actually, one of them sent me an email last year around this time saying, "Oh, I'm so glad people are wearing face masks. It means I don't get to stand out in public." So there is no bad consequence physiologically when wearing a face mask all the time.
Right. And as more people get vaccinated, Doctor, should those who are vaccinated also continue wearing face masks? I know there's a lot of misconception there, but does getting a vaccine just automatically disqualify you from wearing a face mask?
So it's a great question, and it just depends on what you plan to do. For instance, if you've been vaccinated and you plan to hang out with other people who have all been vaccinated, if all of you have been vaccinated, you can put down the mask. The CDC has emphasized that. Now, let me take a quick step back. The purpose of the vaccine is to prevent disease. It does not mean it prevents transmission. So when the vaccines were studied, it was studied to say if you caught SARS-CoV-2, well, you develop a severe form of COVID-19. Preventing severe disease is something known as sterility immunity. However, if you plan to hang out with people who have not been vaccinated and don't have any immune protection, there is a plausible potential that you could spread the virus to them because, again, the vaccine was not proven to stop transmission. And so it depends what you want to do. If you're going to hang out with a vaccine group of individuals in that bubble, you can safely put down the mask. If you're going to hang out with unvaccinated individuals, you should continue to abide by the public health requests of stopping transmission. Because the fear is, if I catch it, even if I'm not going to develop symptoms, I could potentially still pass it on to someone else who has not been vaccinated and therefore cause them to have harm.
It's very important to distinguish the difference between the two groups, knowing the fact that we have our bubbles if we do have our vaccines, and if we don't, we still have to keep others protected. So thank you for that. What are experts like yourself finding about the effects of continued face mask usage? Is one particular type of mask better than another?
So for the purpose of stopping an infectious spread, right, the face masks that we advise have to fulfill three criteria. One, it must cover from the bridge of your nose to the bottom of your chin, right? You have three orifices right there on your face, most people do, where microbes are easily breathed out, right? So two in your nose, one in your mouth. So first criteria, covering the bridge of your nose to the bottom of your chin. Two, it must be a face mask with multiple layers and maintaining consistency, meaning not those masks that have filters in them. Those are used for different purposes, like if I'm going out to fight a wildfire, right? But for the purpose of not spreading germs, you want the mask to be one uniform throughout, right? No filters and so forth, and multiple layers to catch as many of these microbes coming out. The third criteria that I tell everyone, it's got to be comfortable, right? If you're going to wear a face mask that's going to be itchy all the time and you constantly have to pull it off, it's defeating the purpose, right? You wouldn't wear uncomfortable shoes all day. You would be miserable. Don't put on an uncomfortable face mask. Find one that fulfills the first two criteria and you like it. It feels great on your face.
And doctor, here in New York City, the Department of Health actually recommended double masking along with the CDC. A lot of people worry again that double masking can impact their breathing or suffocate them. As a pulmonary specialist, is this true? And do you recommend double masking?
So one of the things I think that got lost in that message is two things. One is we've always emphasized a multiple layer mask. For instance, I go out and teach local schools about the physics of face mask, and we make it clear, like you can take a t-shirt, fold it over in itself, you have a multi-layer face mask. The multiple layers is what we're looking for, right? And that's always been a consistent message. The challenge that we've seen over the last year is an inconsistency in how face masks are worn. Sometimes people are wearing a face mask like it's on, but clearly you can still see their nose, or clearly they're wearing it like a strap, or it's falling down. One of the advocacies behind a second mask is that it kind of helps reaffirm the first one. So it helps keep that mask in good position. So it's one of the reasons why we've advertised it. It's easier to inconsistently wear one mask. It's very hard to inconsistently wear two masks. So from my standpoint, my emphasis is continue wearing a mask with multiple layers, which is almost every mask, and make sure it fulfills the criteria we said earlier. Bridge of your nose, bottom of your chin, covers the entire face, and it's uniform in pattern, and it's comfortable. So to me, like if you want to put on two masks or three masks and your breathing is still fine, sure, go for it. But I wouldn't go as crazy as like I put a duct tape a pillow to my face. No, obviously your breathing then will be impaired. So to me, the multiple masks, right? It's more of a different approach to trying to get people to comply with an appropriate mask wearing and the appropriate mask. That's where I think that's coming from. So I don't want people to be like, what are we going to go up to? Like 40 masks? No, just wear the initial mask correctly and you should be fine.
Right, absolutely. And as we know, face masks have changed a year into the pandemic. As it gets warmer, we're starting to see more diverse face coverings, like shields that go over the face. I'm starting to see those a lot here in New York in particular. Are these shields still protecting people as much as face masks do?
Yeah, so I've always said shields should never be a replacement for a face mask. They can be an adjunct. That's appropriately fine. But keep in mind the shields, your most common ones, still have openings throughout that are much larger in size than a face shield would be, than a face mask would be. So the face shields alone are going to, they're going to be great for the eyes, but they're not going to be great for doing what we wanted to do, which is catching aerosols leaving our nose and mouth. So from my standpoint, I imagine someone could sit back and say, well, I can engineer a great face shield that just kind of boxes in your face. That's fair. But I think the most common face shields that we see still have these large openings at the sides and bottom, and that's going to defeat the purpose, right? Your microbes will still get out there. Like one thing I would just want to say, like we have Mother Nature trying to constantly defeat the human species, right? From earthquakes, hurricanes, wildfires to this pandemic. We have simple tools to defeat it, right? And so from my standpoint, we ended two other coronaviruses in 2003 and 2013, SARS-CoV and MERS-CoV, not without a vaccine, not without a cure. We stopped it with the face masking and physical distancing. We can do that again. So that's it. Face shields I think are great as an adjunct, but not as a replacement.
Right. The ones I've seen around kind of look like the Daft Punk shield that the band wears. Those are popular nowadays, and I see them everywhere. But yeah, for sure, they're not as protective as those face masks that shield our mouths and our nose at the same time. Doctor, we've heard the term long COVID. What exactly is it, and how is it caused, and can it be prevented?
Yes. So actually, let me. We'll stick with the first question. So what is long COVID? So it's been kind of a name dubbed to people who had COVID-19, survived it, and then still are struggling with symptoms. And so from a nomenclature standpoint from the medical world, we usually dub that after about 6 to 12 months. Some of us use more of the 12-month criteria to say if you're still having symptoms after that, then we would call something long. And we see this with other viruses and infections and pathologies as well. So for survivors of COVID-19 who are still experiencing symptoms, we started our clinic, for instance, at Hopkins and many other medical centers throughout the nation to help these patients. Because what is happening is usually one of three things. One, these could be symptoms just around healing. And I say this not to take anything away from the symptoms people are experiencing, but for example, if you broke your leg and you wore a cast for 3 months and I took the cast off, you're going to be miserable. You're going to be in pain as new muscle has to regrow and strengthen. You're going to be in pain. And I tell people that's not a pathological pain. That's a pain part of healing. And your lungs are kind of the same way. After they've been ravaged by COVID-19, it's going to take time for them to kind of come back, right? So you got to be cognizant that you may still be short of breath after COVID-19. So could these symptoms be part of healing? Or could they just have unearthed a subclinical disease that maybe you've always had, but you never really felt the consequences of it until you got knocked out by SARS-CoV-2? Or for some smaller group of patients, a whole new pathology has developed. And so we look through that. The third thing I will say, sometimes we don't know. The constellation of symptoms people are experiencing, we may not have an immediate answer. However, the reason why I advocate to join a post-COVID-19 clinic is because you're going to get these doctors, nurses, psychologists, therapists, all advocating for you to try to figure it out. Because even if we don't have an immediate answer, you're going to have advocacy. The last thing I would say, the best way to assure you don't get long COVID is to not get COVID to begin with, right? And I know that's easier said than done in a time like we are now, especially with COVID-19 fatigue, but don't let our guard down, right? Because Mother Nature's not. She sure is not going to let her guard down. So don't let your guard down, because the best way to beat COVID-19 is to not get COVID-19.
Thank you so much, Dr. Galiatsatos, for joining us today. How can people stay in touch with you and learn more, and just keep in touch with you and your work?
Yeah, no, happy to always reach out to the community. Actually, one of the things that has been incredibly humbling over this last year is so many people have emailed me to talk about cases of their loved ones. Yesterday, had a person discuss their father-in-law's case in Ireland. So you can always email me. My email is always open, and I'm always checking it. Sometimes you may get emails from me at like 3 a.m. Eastern Standard Time. So don't be, I'm just working. I'm also on Twitter. You're welcome. I think my DMs are open, but you're always welcome to kind of send me a message on that as well.
Thank you so much again, Doctor, for your time today.
No worries. Thank you. And it's been an honor. Thank you.
Absolutely. Dr. Panagis Galiatsatos is the Assistant Professor of Division of Pulmonary and Critical Care Medicine, co-chair at JHHS Health Equity. We'll be right back here on Open Tuesday.